we conducted a study, a retrospective analysis of MRI data, and the aim of that was to assess whether diffusion-weighted MRI can be helpful in predicting disease recurrence or disease-free survival in anal SCC. And we use a previously published image heterogeneity workflow in that we drew freehand regions of interest on ADC parametric maps in reference to the high p-value diffusion-weighted sequences. And then we extracted a large number of quantitative features from the ADC maps. And then we used a model cross-validation statistical analysis. We used leave one out cross-validation to first train the models and then test them on all cases. So we had 80 consecutive cases. And in this analysis, we found that two baseline DWI features, namely coefficient of variation and standard deviation, appeared predictive of disease recurrence and disease-free survival in anal cancer. And in addition to this, when assessing the survival curves and the disease-free survival curves, it appeared that the coefficient of variation could predict improved survival, even irrespectively of standard radiological response, so RECIST response, as well as independently of other clinical features. Even though this study obviously had its limitations, most important being lack of external validation of the potential biomarker, as well as the risk of model overfitting, given how many features we've looked at as compared to the relatively small number of events. Still, we feel that the observation that the coefficient of variation of ADC at baseline was associated with disease recurrence requires or warrants further investigation and testing in prospective trials.